When a person is displaying the negative symptoms found in schizophrenia, they withdraw socially. When you deal with them, they might seem to have a lack of emotion. They can have a very flat affect. They don't respond with a lot of spontaneous expressions and speech that makes it easy to converse. They appear to have a lack of energy and sometimes might display decreased motivation. They won't have the drive to get out and go to school, to work, to interact with others. Things that used to make them happy, things that they enjoyed, they no longer want to participate in. And you might notice their personal hygiene will suffer. They don't feel the need to wash and wear clean clothes, take care of themselves. And they display sometimes poverty of speech, which is you'll ask them questions and you'll just get brief replies that don't really help you any. Yes, no, I don't know, maybe, just very little answers to any questions that somebody might have for them. So we want to try to keep those symptoms to a minimum. We want to decrease the positive symptoms and increase their ability to function and communicate. And one of the first things that we have to help with that process are the conventional antipsychotics. The ATI book starts talking about them on page 65. These drugs try to increase the metabolism of the dopamine that is produced in the brain so that the person has as much as they need but not too much. These drugs will also decrease the reuptake, the brain taking up these other neurotransmitters and recycling them so that they're not available for use in the brain. So they want to increase the amount of serotonin and norepinephrine to balance out the dopamine. Sometimes these drugs will help to keep these neurotransmitters in balance, and that stops all that stimulation. Sometimes these drugs are very sedating. So like I said, people complain of talking about just feeling like they're not themselves or like they're out of their body. A long time drug that has been used is a drug called Thorazine. The generic name is chlorpromazine. And Thorazine has been used for years to kind of keep control of the symptoms of schizophrenia and other psychotic disorders. It's not a easy drug to be on, but for a while it was all that they had. It is essential that people prone to psychosis have a supportive family or some other sort of support system to keep them to get in there and think clearly when the person is not able to. Sometimes when in a remission state, a person with schizophrenia has great intentions of keeping up with what they're supposed to do, continuing their job, and anything else that they're required to do, and take their medications. But if there's any little slip, any little period of time where they're not in touch with reality, that can go out the window and things can really go downhill quickly. So having a family or some kind of daycare situation, somebody to keep the person safe, to keep them reoriented. And it certainly doesn't hurt if they have a safe place to sleep, a good balanced diet, appropriate exercise. All of that can help with their general health as well as taking their meds. As I mentioned, we have to keep on the lookout for extrapyramidal symptoms. Tardive dyskinesia happens because of less dopamine, so it can mimic some of the symptoms of Parkinson's. Anticholinergics, like a drug called Cogentin or benztropine, can also reduce those symptoms by trying to balance out dopamine and acetylcholine. If you notice any new muscle spasms, clumsiness, abnormal facial tics or movements, it's important that the healthcare provider is contacted, because with the conventional antipsychotics, once this damage happens in the brain, it's irreversible. So Thorazine used to be responsible for a lot of these extrapyramidal symptoms, and once the person had been on it for a long time, they pretty much became permanent. You'd read about people going to psychiatric institutions and seeing what they called the Thorazine shuffle as the pseudo-Parkinsonism kind of took over. You just see them not really being able to lift their feet, just sort of shuffling along in the halls. ATI divides antipsychotics into both conventional and atypical, which goes a little bit more in line with how Ms. Wigger will teach in mental health in your senior term. Our textbook just kind of divides things up slightly differently. So to make it easier to remember what you've learned next term, we're going to just keep in mind what the ATI says. This is an example of a woman with tardive dyskinesia, and you can see the progression of abnormal facial movements, and you would see this with these patients. They just continually have facial tics and involuntary movements of the lips and mouth and tongue. They would even develop what was called vermiform tongue, where they can stick their tongue out and they can sort of make it wiggle like a worm, and that's why they called it vermiform. So, very disconcerting to the people who see that and distressing for the patients themselves. Atypical antipsychotics are listed on page 68 of your textbook. The example drug or the prototype drug is a drug called risperidone or Risperdal. Rather than causing a lot of central nervous system problems, the things that you see with these atypical antipsychotics are different. You see side effects. They will have higher glucose, and as the body produces more insulin to try to cope with that, that can cause a weight gain. You'll also see increased cholesterol, a lot of orthostatic hypotension that makes them more of a falls risk, and a lot of the anticholinergic effects, the blurred vision, the dry mouth, the urinary retention, constipation. Weight gain is an expected side effect. It's very upsetting and depressing for patients, and I'm talking like a pound a day weight gain, 30 to 50 pounds in just a few months. And imagine being a young person, because schizophrenic symptoms usually happen in late teens or early 20s, and imagine going from a weight that you're happy with to 100 pounds heavier in a year. That's going to be very distressing and is not going to make a person want to stay on their medication.